Good afternoon, and thank you for joining us for our weekly update. I'm very pleased, as always, to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health, Deryn Rizzi, who is our Fire Chief and our Director of Emergency Management, Sam Rogers, our Director of Enforcement, and a very special guest this week, Dr. Abdu Sharkawy, Internal Medicine and Infectious Disease Specialist at the University Health Network. Dr. Sharkawy has been on the front lines of this pandemic at the Toronto Western Hospital, and I asked him to join us today to talk about the situation at our hospitals and what he believes needs to be done to get control of this pandemic. Let me clarify that Dr. Sharkawy is one of our more famous residents here in Peel as well. It has been an incredibly busy few days in terms of new announcements from the province and from the region of Peel. I know a lot of residents have questions about exactly what is going on. But first, I want to paint a picture of the situation that Mississauga and Peel region face. The reality is that things have never been more serious. The region's 7-day moving daily average of cases is up to 801, and that's up from 747 just 1 week ago. In Mississauga, we're now averaging 275 cases per 100,000, and that's up from 226 cases per 100,000 a week ago. Both Trillium and William Osler hospitals continue to transfer patients to hospitals across Ontario. And if it wasn't for these patient transfers, both Osler and Trillium would be completely overwhelmed. Trillium, for example, is transferring out up to 10 patients per day to hospitals in southwestern and southeastern Ontario, from Chatham to Kingston. Trillium is dealing with 138 COVID patients, 29 patients in the ICU, and 50 suspected cases. The situation is similar at William Osler Hospital, with 189 COVID hospitalizations, 28 patients in the ICU, and 63 suspected cases. ICU doctors fear that hospitals across Ontario will soon be in a situation where gut-wrenching decisions will have to be made about who does and doesn't receive life-saving care. I spoke with the leadership of both hospitals yesterday, and they are both in desperate need of more support. I'm thankful that Prime Minister Justin Trudeau is making more support available to Ontario, working with other provinces and territories to coordinate staff and supply to our province. Mississauga, our situation has never been more dire, and now, more than ever, we need to be making strategic decisions to halt this third wave and to save lives. We need to make decisions that are based in science, decisions that are backed by what the data is telling us. I'm incredibly proud and relieved that Dr. Lowe has put forward new rules directing all businesses with 5 or more linked cases in the past 2 weeks to close for 10 days. This order specifically applies to businesses with COVID-positive employees who could have reasonably acquired their infection at work, or where there is no obvious identified source of infection outside the workplace. I realize this will be very difficult for many employers as well as the employees, but I firmly believe that this is a necessary step to halt the rampant spread of the virus in Mississauga and in all Peel region. We have long known that workplaces are driving the spread of the virus. Since the onset of the pandemic, Peel region has seen 402 workplace outbreaks. Currently, there are approximately 100 active workplace outbreaks in Peel. And we know that this ultimately leads to household and wider community spread. This new order will make our workplaces safer and protect our essential workers who have shouldered a disproportionate amount of the risk during the pandemic. We also know that people often go into work sick rather than isolated home because they fear losing their paycheck. A study by Peel Public Health found that 8,000 workers who contracted COVID-19, almost 2,000 of them, 1 in 4, went to work with COVID symptoms. 80 went to work after receiving a positive COVID test. The action that Dr. Lowe has taken is necessary and addresses where the transmission is occurring. The first business closure could be ordered as early as this Friday. And the new rules will be in effect as long as Peel remains in lockdown. I encourage all employers impacted by this new order to please provide paid sick leave to their employees. Dr. Lowe can answer more detailed questions about the new rules, including what businesses will be exempt from full closures due to their essential nature. I want to again thank Dr. Lowe for his courage and for taking a lead on this very important issue. Right now is the time for the province to also take a hard look at what businesses are truly essential and which ones truly need to stay open. The list needs to be shortened, something Ontario's Science Table was calling for in their new report that was released yesterday. If we know that workplace transmission is driving the virus, let's only keep open workplaces that truly need to be open, the truly essential ones. The Provincial Science Table also made it very clear in their report that paying essential workers to stay home when they're sick, when they need to isolate, when they're waiting for their test results, and when they need to get vaccinated is a critical way to get Ontario out of this pandemic. Plain and simple, we need to get the province to work with the federal government and mandate paid sick leave right now. Along with other mayors, health experts, and Labour advocates, I've been asking for this for months. Time is up. We cannot afford to wait any longer. We know the federal program is not sufficient. We know that it's cumbersome to apply for. We know that it doesn't provide immediate support. And we know that it doesn't provide enough money for people to live on, particularly in the GTA. I know Ontario's Ministers of Health and Labour recognized yesterday that a glaring gap exists. And today, I was encouraged to hear that the province will be coming forward soon with enhancements to the federal paid sick program. I'm really looking forward to this announcement, and I'm urging the province that the program that they do bring forward ensures that when people need to isolate, that there is no disruption to their wages, and ensures that we can backstop employers so there are no additional costs to them either. The Science Table is also recommending that the province prioritize vaccine to the hotspot regions. I was very thankful that the Premier announced on Friday that hotspot regions like Peel will receive 25% more vaccine going forward. But the truth is, we need even more than that. I'm urging the province to revise their vaccine allocation strategy to ensure that hotspot regions like Peel and Toronto receive as much of the vaccine as possible and as soon as possible. The sooner we get residents in hotspot regions vaccinated, the sooner the rest of the province can get out of lockdown. The reality is that Peel, Toronto, and York are holding back the rest of the province right now. My office has been inundated with calls over the last week with residents asking when they'll see a mobile or pop-up clinic roll out to their neighbourhood, asking when everyone 18 or older will be able to get vaccinated in hotspot zones. The truth is, we simply don't have the supply of vaccine right now. We are still busy getting residents 50 years of age and older vaccinated in hotspot postal codes, along with educators and other groups prioritized by the province. Canada also continues to battle supply issues, with shipments of Moderna and Pfizer reduced during the month of April. At our mass vaccination sites, We only have enough vaccine to satisfy the appointments that we have already booked. I know this is frustrating for many residents. I'm frustrated too. But I ask for your patience as we continue to advocate to the province to get us more vaccine. But it's not all bad news right now. We're still administering more than 12,000 doses per day here in Peel, and to date, more than 400,000 doses have been administered right across our region. Residents 40 and older can now book an Astrazeneca vaccine at pharmacies in Peel. While I know there are some concerns with the Astrazeneca vaccine, the risk of complications are extremely low, and perhaps Dr. Lowe can address those further in his remarks. Some more good news. Our firefighters are also finalizing a partnership with Trillium Health Partners where they will be trained to administer the vaccine. Chief Rizzi, I want to thank you for your leadership on this, as well as the leaders at Trillium Health Partners. And I want to thank our firefighters for stepping up and being ready to help out when called. Getting our firefighters trained to vaccinate is so important right now. We know that our hospitals are overwhelmed, and staff at the mass vaccination clinics may soon be recalled to help with critical care at the hospitals. If that happens, our firefighters will be ready to step up and keep getting vaccines in arms. Before I bring up Dr. Lowe, I want to address some other provincial announcements from last Friday. The province extended the provincial-wide stay-at-home order until May 20th, and also brought in a host of new measures. I do want to thank the Premier for signaling to Ontarians how serious the situation is. But I was strongly opposed to enhancing the powers of police to arbitrarily stopping and questioning people. I also believe that the risk of transmission from outdoor activities is extremely low, and I was disappointed that playgrounds and other outdoor recreational activities and amenities were closed. The science table did not support these actions either. I received so many emails from residents on how frustrated, disappointed, and frankly angry they were at some of these measures. And I was very relieved and thankful that the Premier and the Solicitor General listened to Ontarians and walked back the policy on enhanced police powers. I want to thank my fellow mayors as well from right across the province who voiced their opposition on this policy, as well as police leadership from right across Ontario, including here in Peel, thank you, Chief Nish, that made it very clear they were not in support of this either. I do want to thank the Premier for also lifting the restriction on outdoor playgrounds. As you know, outdoor recreation is essential to the overall health and well-being of children and their families. But it's also essential to adults. So I'm asking the Premier to please reconsider restrictions on outdoor recreation, such as golf and tennis. Mississauga, please stay safe. Please continue listening to the advice of our public health officials and keep all your close contact to those of just your immediate households. Please get vaccinated as soon as you are eligible. And now I would like to invite up Dr. Lowe to give his update. Thank you. Dr. Lowe.
Thank you, Madam Mayor, and good afternoon. I want to also start by saying that I'm honored to be here with my esteemed friend and colleague, Dr. Abdu Sharkawy. Mississauga's weekly incidence rate for COVID-19 currently sits at 275.5 per 100,000, with a test positivity of 14.5%. In the last few weeks, the voices of my friends and colleagues in hospitals like Dr. Sharkawy have grown even more prominent in the public discourse, reflecting the grave situation unfolding in our hospitals. When our hospital colleagues urgently add their voices in alarm to those of us in the community as medical officers of health, that is a sign. It is a sign that what is unfolding in our hospitals and community shows that we are moving into one of the most critical and severe phases of the pandemic. This third wave is battering our hospitals. Surgeries are canceled. Pediatric admissions are being diverted. Field hospitals are operational. Care is being delayed. And more COVID-19 patients are showing up sicker, younger, staying for longer, and being transferred all across Ontario, simply to get care. So I urge you, please, listen to the stories of what my hospital colleagues are seeing. To some degree, this third wave reflects the result of the strident push to reopen so quickly after the stay-at-home order in February, and the continuing non-compliance among those who have the privilege to reduce their contacts but choose not to. It also reflects, as it always has, the ongoing struggle to get protections for our precariously employed, vulnerable workers who cannot work from home. So let me be very clear. If our hospitals run out of beds, no one can get treated. Not only COVID-19 patients will be turned away, anyone. Knee replacements, cancer procedures, and what happens with emergent things like heart attacks, strokes, or trauma. That this might eventuate in our community is an unbearable thought. Make no mistake, however, we continue to vaccinate steadily. Across our mass vaccination system, we are doing 100,000 doses a week in all modalities and are adding pop-up and community outreach clinics in the coming weeks. Here in the region of Peel, we are over 40% vaccinated in our over 60-plus age group and are on pace to hit or exceed the provincial target of 40% in our community by May 5th. But we cannot vaccinate our way out of this fast enough. Close, vaccinate, and exit, the same path that other countries before us took, relies on us to conduct a final closure that reduces contacts and brings this third wave under control. It's about saving lives and the healthcare system while pumping up vaccine as quickly as possible to interrupt community transmission. It's also why we've kept many things closed. Though I know it has been hard, it has clearly been necessary, because while people will argue that restaurants and barbershops weren't the source of spread, they were closed when the data was being collected. And so the data reflects that. We have seen how at the levels of transmission we have now, that they can very quickly become the source of spread when they do open, in lessons learned from other parts of the GTA and beyond. With businesses that stay open, our recent Workplace Section 22 amendments aim to address transmission through expedited closures to save lives by protecting our workers and our community. And while paid sick days seem to finally be given some reasonable consideration, we must do what we can now to respond quickly to workplace outbreaks, and expedited closures are a way to interrupt transmission sooner and bring about more rapid response in outbreak investigation. It is one more tool in public health's arsenal to try to bring this third wave under control, but the rest of it is very much in all of our hands. So please, as much as you can, reduce your interactions, stay home, stay safe, and get the shot when it's your turn. The sooner we all get a shot, any shot, the sooner we will get out of this. Finally, I want to thank our employers for their patience with the new regulation that has come down, and I urge you to please work with us to protect your community and your employees. Please ensure that any impacted employees are given paid leave and comply with workplace investigations. The variants are spreading faster and further when they do get in, and lives are very much at stake. Close, vaccinate, and exit. I'll thank you, and I'll pass it back to Madam Mayor.
Thank you, Dr. Lowe. Dr. Lowe painted a really grim picture of what the province is currently facing, particularly our hospitals and our healthcare system. And to give us another perspective on that, and what needs to be done to halt this third wave. I'm so honored to have someone special join us today. Dr. Abdu Sharkawy is here with us today, one of our residents. Dr. Sharkawy, the floor is yours. Dr. Sharkawy? Can we get Dr. Sharkawy on? If not, we can continue and try and get him back.
Hello?
No, there he is, Dr. Sharkawy. The floor is yours.
Thank you so much, Madam Mayor Crombie, and my esteemed colleague, Medical Officer of Health, Dr. Lowe. It truly is an honor and a privilege to share this forum with you. I wish it was under different circumstances, and I thank you both for your tremendous leadership and resolve during what really is a historic crisis for us in Peel Region and really for the entire province of Ontario, most specifically Peel, Toronto, and York region, which have been disproportionately affected by this crisis. I think we're all fairly well acquainted at this point in time with the gravity of this situation as it has unfolded in the third wave. But I think what we need to grasp with a bit more attention and a bit more understanding at this point in time is what this is meaning on an individual level and what this holds for us in terms of what we can expect to happen if the situation does not turn around and turn around very, very quickly. Make no mistake, this pandemic has been about vulnerability. It has been about inequity, and it has been about a disparity of resources and attention to those of us in our society who have been less privileged and frankly neglected far too long. The first wave of this pandemic, and to a secondary extent, the second wave of this pandemic, were largely the face of those living in long-term care. And there were painful lessons to learn about the laggard response that led to many lives being cost in our seniors and in everybody living in the long-term care community, sometimes in those who supported them from a staff point of view. The face of the third wave is one that is very much different. Despite the fact that we were laggard in our response, we have at this point managed to vaccinate most of our long-term care residents that are in the highest risk areas, even in hot zones. And now we have shifted to a more vulnerable part of our community, which is younger people who remain susceptible to this virus by virtue of working crowded, unsafe, congregate work environments or in public-facing circumstances, whether they may drive for ride shares, whether they may be teachers or work in the public education system, or whether they work in the grocery or retail sector, where they have little choice but to be in contact with multiple members of the public on a regular basis. When we say essential workers, we are defining the fact that it is a privilege that we have to stay at home that is not shared by these people, many of whom live in very difficult circumstances where they do not have a backyard. They do not have the physical space to allow them to distance or to self-isolate properly if they live in a multi-generational home with people who may be very elderly, immune compromised. And if someone comes home sick from work, it is a given that the virus will spread throughout their entire family. It is a question of when, not if. It's been very painful for me personally to leave my home in Peel Region each morning over the course of this third wave and come downtown to Toronto Western Hospital and see the reflection of what's going on a personal basis in our emergency rooms and in our ICU. And I've been in contact with my colleagues at Trillium Health Partners and Credit Valley Hospital, and I can tell you that the situation is very much the same. Our ICUs are near 40% or greater capacity with COVID-19 patients. We are seeing many a scenario where ages range from people in their mid to high 20s to their low 50s who are extremely sick, on ventilators, on maximal support, sometimes needing to be transferred to unique locations that can provide only resources that are available there. It is tragic when I have to share the news with a young daughter that her mother has died of COVID-19 when they are separated by 3 or 4 rooms in the same critical care unit. But this is a scenario that has been witnessed far too frequently. We have had entire families admitted to hospital at a given time. We have had some of these young people die, and those who have survived often have been left with debilitating circumstances that perhaps they will never recover from. That might include never being able to breathe normally again without supplemental oxygen through a portable tank at home. That might be not being able to function because they've suffered a disabling stroke through a clot was related to COVID-19. For some, it's the ability to smell properly that has been forever tainted, and they will not be able to smell a fire if it is burning in their kitchen, or to appreciate the delight or the simple pleasure of food that is cooked the right way and that they can enjoy. Never mind the extreme psychological, debilitating toll that this takes on any young person, who often takes months to recover from being on a ventilator and sometimes will not recover entirely at all. This situation is untenable. We are building tents in our hospital parking lots as we speak. We are making decisions as we speak about not who will or will not get a ventilator, but who will even be admitted to an intensive care unit, for the prospect of true intense monitoring, one-on-one care. And with our healthcare team being decimated because of the toll this pandemic has taken on us, and with resources that can only go so far, because ICU beds aren't populated with ICU physicians or nurses or respiratory therapists or physical therapists or dietitians or pharmacists, or all the people that we rely on to provide the expert and dedicated care, then an ICU bed is nothing but a space. It's a pillow and an empty space that cannot truly and meaningfully offer the care that every Ontarian deserves as a citizen, who deserves the respect and the dignity for the best form of health care available to them. The situation is dire. I cannot emphasize that enough. There are many situations that are not within our control. The vaccine supply is not something that we can easily dictate. The allocation is one that we can certainly advocate and strategize more efficiently so that we target and streamline them more effectively to our essential workers and to as many people as possible living in difficult circumstances in our hotspot neighborhoods. We can advocate. Please let your voice be heard however you can, through social media, through your municipal authorities, through your MPP, any way that you can stand up and say that this is not good enough and we need attention is something that will not fall on deaf ears. We have seen what has happened over just the span of the last few days when there is enough of a groundswell of public sentiment that we can influence our policymakers. And I thank the Premier and I thank our provincial government for listening to the people of Ontario when they say, we need your help. Please don't lose hope. Please remember that there are a lot of resources. If you have questions about vaccines. A vaccine that is not taken by anyone who is eligible within Peel Region is a vaccine that is costing the lives of someone else, even someone who is living under more difficult circumstances. The chain of transmission starts with you and will often end with someone you cannot see and will never meet, who is several links away from you and who may be at risk of dying from this deadly disease, or perhaps never recovering entirely if they survive. Similarly, the chain of protection will hopefully provide the same level of hope that if you are vaccinated, that the chain of solidarity and protection that prevents the virus from circulating, especially variants, will not find its way to those that are more vulnerable, that are living in susceptible circumstances that will not change quickly. Please know that the risk of clots is much, much higher. The risk of every single serious medical consequence is far greater from COVID-19 itself than it is from a vaccine. There are younger people, particularly women, that should seek expert opinion and advice with respect to the Astrazeneca vaccine. But that group is extremely small. For the vast majority of you, if you can get the Astrazeneca vaccine, remember that it is a vaccine that is 100% protective against severe complications, hospitalization, and death. You owe that to yourself and to everyone living in your community. Please do your part. We are all accountable, and we can all do something, no matter how few resources we believe we possess. We can do this. I believe in the great people of Peel Region. I believe in our leadership. I believe in the will and the conviction and the passion of Canadians to turn this around. Let's do it now before a historic tragedy continues to unfold. Let's not leave any regrets. Thank you so much to everybody who's working diligently, passionately, sacrificing selflessly to do their part to save people in our community. I'm very grateful. Thank you.
Thank you for your very powerful comments, Dr. Sharkawy. I know that there have been a lot of questions over the past few days over the situation at one of our gyms here in the city. And now I'd like to invite up Sam Rogers, who is our Director of Enforcement, for his update. Sam, over to you. And that will be virtual, I believe, as well. Sam.
Thank you, Mayor Crombie. Are you able to hear me?
Yes, we can, Sam. Thank you.
Perfect. Thanks again and good afternoon, everyone. As Mayor Crombie said, I'd like to provide you with an update on the Huff Gym situation. So as a result of ongoing violations of the Reopening Ontario Act, enforcement officers are in the process of laying 4 charges against the business for obstruction, operating a non-essential business, indoor gatherings, and violating a temporary order to close. Each of these charges may result in a fine of up to $500,000 and a term of imprisonment of not more than 1 year. In addition, 2 tickets were also issued to patrons on Thursday, April 15th. These are the most significant charges that have been laid against any single individual or business in the city since the beginning of the pandemic. This is also the most egregious act of public defiance that we've experienced in the city, and we are extremely concerned. On Thursday, April 15th, the situation at Huff Gym escalated from a non-essential business violation to a protest of over 50 people. Peel Regional Police became the lead enforcement agency, and as in any protest situation, public safety took precedence. So this leaves us in what has been referred to as a standoff situation. As of today, Huff Gym appears to still be operating illegally. However, we have been unable to confirm if this is the case because they've continued to lock their doors and refuse entry to enforcement and police officers. However, Further legal action is being pursued by the City and Regional Legal Services through the Ministry of the Attorney General. If the business continues to violate the regulations, the City intends to request that the Ministry pursue an injunction which could provide some more options to shut down a business that continues to violate the laws. Now, this will take time to work through as it is a serious step and due process must occur. In other words, at this point, there is no quick and easy path to shutting down the establishment without jeopardizing public safety. Huff Gym ownership is now facing millions of dollars in potential fines as well as imprisonment. They have put themselves and others at risk, including our frontline officers. However, I am pleased to advise that other gyms and businesses have chosen to act responsibly and comply with the regulations. In fact, other gym establishments have contacted us this past week to ensure that they understand the rules and avoid any unintentional violations. I'd like to thank all of these businesses for their continued efforts during this most difficult time. And I remain hopeful that Huff Gym reconsiders their position and moves quickly to cease operations. I'll now hand it back over to Mayor Crombie.
Thank you, Sam. And due to the length of our comments today, I think we will go directly to media questions, and I'll have a few comments on COVID heroes if there's time, and if not, we'll push that to next week. So over to questions, please.
Your first question is for Dr. Lowe. It comes from John Musselman at CTV News. Go ahead, John.
I'm wondering if you may paint a picture for some of these places.
Sorry.
Lunchroom floor.
Sorry, John, you're cutting in and out. We're actually going to go to a next question.
That was about what businesses were you closing?
I think, yeah. Sorry, thank you. Thank you for the question, John. Mayor Crombie advises me the question is in respect of which businesses will be closing, and so certainly that information is being worked on by our team ahead of the effective date of the order on Friday. We have a number of workplace investigations that are currently active. There are more workplaces that are having outbreaks that are detected every single day. And obviously we will be sharing once the order is effective, but in the process are also trying to ensure that we are working directly with businesses and ensuring that they're aware of things first before we disclose anything publicly. So thanks for the question.
The question.
Is there a follow-up, John?
Yes, what's happening in these workplaces that cause this transmission? Where is the breakdown?
He's coming in.
So yeah, thanks for the question and follow-up. So in respect of what's causing transmission in these workplaces, there's a number of things. Really, any place that is still open where people are gathering, meeting in person, represents a potential risk for transmission. We do know that precautions, even if they are followed, are not 100%. We do know that there are situations where, the variants are that transmissible, and even with everything done right, if you're within close proximity, there's always the opportunity for a slip or a lapse everywhere here or there. The fact of the matter is that with community levels of transmission where they are right now, as high as they are right now, any interaction with anybody outside of your immediate household represents a risk. And so I think that speaks to the broader advice that we have to everyone to reduce their contacts as much as possible. And then the significant issue in workplaces where we know the variants spread further and faster and hence has necessitated this updated order to expedite closures where cases are detected. Thanks for the question.
Next question, please.
Your next question comes from Isaac Callan at The Pointer. Go ahead, Isaac.
Hey, Mayor Crombie.
Welcome, Isaac.
Thank you. I want to clarify the issue around the firefighters and their role in the vaccination, and perhaps ask the Chief and Dr. Lowe if this was part of the original plan, or if this is a sign of the level of strain on the system that it's been necessary to take this step.
I'm going to tell you it's a sign of the strain of what's been happening. So I'm going to ask Chief Rizzi to come forward and explain, and then Dr. Lowe will have his opportunity. Isaac, over to Chief Rizzi.
Hi, Isaac. Thank you very much for the question. So, Isaac, as you know, firefighters put out fires, they attend motor vehicle collisions, they help with medical emergencies, and we're so proud to be able to say we're going to be helping put vaccines in people's arms. And I'd like to thank Mayor Crombie for helping to facilitate this. Obviously, we've been talking for quite a while in terms of how can firefighters get involved in the fight against COVID-19. And we're certainly very pleased that this partnership has come about, and we look forward to the training that we're taking next week and getting on the front lines and helping.
Dr. Lowe? Yeah. You think it's fine? Isaac, Dr. Lowe feels that Chief Rizzi adequately responded, and he is in full agreement.
Fantastic. Could I get Dr. Lowe for my follow-up, please?
Yep, absolutely.
Go ahead, Isaac.
Hi, Dr. Lowe. I just want to ask about the issue of vaccine hesitancy, which I know was a concern, particularly early on in the rollout in the Peel region. And just now that you've got a bit of an idea of some of the coverage through some of the age groups, if vaccine hesitancy has turned out to be a big issue in Peel, and if it's something you're dealing with, or if sign-up to other age groups has been at the level that you would have hoped.
Yeah, thanks, Isaac. I mean, our hospital clinics and our mass vaccination clinics continue to vaccinate over 12,000 doses a day. Together with mobile modalities as well as primary and pharmacy channels, we are approaching 100,000 doses a week throughout the region of Peel, and all of those doses are being delivered. I know our clinics at some point, especially during a switchover in the provincial system, were booked at 130% over the course of a weekend. So there is significant uptake amongst our community. We're working very closely with community ambassadors to address vaccine confidence in groups, particularly some of our hardest hit or some of our most vulnerable populations, to ensure that they can have access to vaccine. And of course, we are working and will be announcing at Regional Council an expansion to our mobile and community outreach offerings. So thanks very much for the question, Isaac.
Next question, please.
Your next question comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Welcome, Steve.
Mayor Crombie.
Welcome.
Thank you. Just while I've got you at the podium here, I wanted to ask you about the Lakeview or the Lakefront increased penalty zone for parking that council passed this morning. I understand, obviously, certainly during COVID, the kind of outdoor activities are, they're in high demand, and obviously the waterfront of Mississauga is a wonderful place to visit. So, and I also understand the council is probably having to balance local residents to the waterfronts and their concerns over, being overwhelmed by visitors. But I just wanted to ask, is increasing penalties at this time, when people are kind of going outside and enjoying the outdoors, is one of the only few safe things that we can do? Is it fair to kind of visitors to the area to kind of have more penalties potentially?
Well, I understand your point, but I think you've covered most of the rationale yourself. In addition, we do have to put a value on that real estate, and it is very important that we continue to put money away because, as you know, in Port Credit, we have a parking deficit and need to build more parking structures there as well. So while I agree with you, people do need to be outside, and we do waive those parking fees, certainly in high retail times, like, well, in the past, Christmas time, high shopping periods, but this time in particular, they're quite overdue for an increase, and so we thought it appropriate today to make that move.
Follow-up?
Thank you.
Yep.
Thanks. I might follow up for Dr. Lowe, please.
Sure. I'll bring him forward.
Go ahead, Steve.
Hi, Dr. Lowe. I just wanted to ask about the Section 22 from this week, expedited closures. In the past, you'd expressed some kind of hesitancy or around naming businesses that Peel Health was investigating for concerns that they may or may not kind of cooperate, or there has been some issues with that in the past. But I'm just trying to, can you take us through kind of how your thoughts on this have changed, how the spirits have kind of changed around naming businesses that will be shut down?
Yeah, Steve, actually, the policies are not inconsistent. Peel Public Health will continue with our consistent policy around a disclosure of outbreaks at workplaces. I think there's a recognition, especially with the workplace information, that the outbreak information about workplaces on our dashboard, that the naming of a workplace with the number of cases still could potentially be identifying, particularly if it's a small workplace and the number of cases might correspond to the number of employees. So that would represent represent a risk, a stigma, and also an issue with ongoing investigations into a workplace. However, a closure, an expedited closure, is a different thing, as you know, and it's also something that would be very publicly known in general once it is issued. And it's for that reason that in the course of an expedited closure, we have agreed to name the workplace and the date of closure for the duration of the time that the workplace is closed. So I hope that clarifies. They are two policies, and in naming just the workplace and the date of closure without the number of cases, it does not necessarily infringe upon people's right to ensure that the personal health information remains confidential. Thank you.
Next question, please.
The next question is from Ashley Newport at Mississauga. Go ahead, Ashley.
Welcome, Ashley.
Hi, Mayor Crombie.
Well,
thank you. Thank you. So I know today at Council there was some talk about the pop-up mobile vaccination clinics in Toronto, the ones that are in hotspots for people 18 or over. And I know there were some concerns raised about how in Toronto, at least, there's been, problems with the first come first serve style where people wait in line for many, many hours and sometimes don't get a vaccine if they run out, which is possible, of course, with supply being still limited. I'm actually wondering if there's any updates on how Peel, like the region of Peel, plans to run its vaccination mobile clinics for people 18 or over, if you have any more details to share, such as when they're going to be coming up and how they'll work, if they're going to be appointment-based, for example, or if these will be first come, first serve as well.
Right. So I'm going to ask Dr. Lowe to come to the podium, but as soon as we increase our supply of vaccine, Ashley, we'll be able to undertake some of those pop-up and mobile clinics. I know that Dr. Lowe has plans for some. I believe the first set is with a large employer, but he can tell us more about it. It's, I think, still being finalized. I prefer, frankly, the mass vaccination centers. We're able to do 13,000 people in a day, over 100,000 a week. So we're doing so well to get, and they are so efficient and so well run. I have to commend everyone, our Peel Public Health for operating our sites and Trillium Health Partners for operating the rest. They're very, very efficient. And of course, you can cover from the inclement weather as we've been experiencing today. That's not to say there may not be some pop-up clinics in some religious or cultural areas as well to accommodate individuals, as we saw in BAPS in North Etobicoke. And why don't I let Dr. Lowe come up and tell you about his plans. Thank you for the question, Ashley.
Yes, thank you, Madam Mayor. Thank you, Ashley, for the question, and certainly grateful for Mayor Crombie's support. And it is very clear that our mass vaccination clinics continue to put significant numbers of people through every single day. And with 85% of our residents living within a defined hotspot in Peel, you can guarantee that pretty much all of the people that are going through those clinics are likely resident in one of those hotspots. However, that said, we have had mobile vaccination clinics since the start of our vaccination campaign. That was how we did many of our long-term care and retirement homes. And then since the end of our long-term care and retirement home campaigns, the mobile units have been going out to seniors' apartments, to condos with lots of seniors or group living situations, shelters, in line with the province's phase 1 stated prioritization frameworks. We had identified almost 120 such venues in the hotspots within our community, delivered over 10,000 doses via mobile modality. So mobile is not something new here for us in Peel Public Health. We've been doing it for months. However, with the recent question around pop-ups in workplaces, we have been in discussions with employers, with community centres, with the province to really identify how we can expand our mobile offerings to supplement the numbers that are going through our mass vaccination clinics, and all that information will be presented at Regional Council tomorrow. Thanks for the question.
Follow-up?
Yep, follow-up.
Thank you. And my next question's on a completely different subject. Earlier this year, I think it might have been in January or February, Council talked about revisiting potentially allowing backyard chickens. And I think that was supposed to come up again in March, but there hasn't been, I don't think it's come up again unless I've missed it. And if so, I apologize. Is this something City Council is still actively considering? Is there studies or reports that you're evaluating to see whether or not Mississauga will, especially as, the weather gets better and people maybe look for more hobbies that are outdoorsy? Is backyard chicken still something that the city can see itself approving or regulating in the coming weeks or months?
It's a great question, and yes, it is coming forward in the next week or two. I can't tell you if it's next week or in 3 weeks, but it is coming up soon. So Ashley, stay tuned, and we can respond to the questions after the debate at council. Thank you for the question.
Madam Mayor, I'll just jump in real quick.
Sam, that's
Sam
right.
here.
There you are.
Yeah, no, that's okay. Yeah, Ashley, your timing's perfect. It's coming to GC next week, the 28th. It's slated to come to General Committee, so your timing's perfect on that question. Thank you.
Okay, next question.
Your final question for the day comes from Khaled Salama at My Second Home TV. Go ahead, Khaled.
Thank you. Hundreds of the operators of independent pharmacies in Ontario were vaccinated and they were ready to deploy the vaccines. But what we have seen is only the pharmacies of the big chains like Shoppers Drug Mart. Why we have seen this?
So, Khaled, I will tell you that it is the province that is entering into agreements with these pharmacies, and I know that there are legal agreements that are quite lengthy and quite onerous, and there is a lot of liability, of course, in participating in that program. And I don't know if Dr. Lowe has any more information. He may. He's coming forward, but I think largely this is a project that has been brought forward to us from the province. Dr. Lowe?
Thank you.
Sorry, Mayor Crombie, which program was this again? Yes. Absolutely, Khaled, the province works directly with pharmacies in ensuring that they receive vaccinations. So in general, questions around the pharmacy program are probably better directed at the Ministry of Health. Our involvement as Peel Public Health has really been to share our data and understanding around hotspots in our community, which the ministry then uses in terms of identifying and selecting which pharmacies are able to access the allocation. But again, those decisions are made by the Ministry of Health, and I would encourage you to direct your questions there. Thanks for the question.
Thank you. And
follow up?
Thank you, Amir. Dr. Sharkawy mentioned earlier that patients or recovered patients will be losing the smell or debilitating the lung functionalities and whatever. And I want to ask what else and what other damages could happen to a recovered COVID patient, and would be he considered a disabled person after that?
So I'll ask Dr. Lowe. I don't think Dr. Sharkawy is still participating. Is he still on the line?
Yeah, no, I'm here.
I'm going to leave that to you. I'll leave that to the medical experts. I know they talk about long haulers and lingering effects, but let's let the doctors respond.
Yeah, so I'm very glad that you asked that question, because unfortunately, these are the stories that don't make the headlines because these patients survive. We only hear about them when we see them. We have a COVID long haulers clinic here that is spearheaded by my excellent colleague, Dr. Angela Chung. And I can tell you the patients that we see are very young. Many of them are either in their late teens or early 20s. And there is a very, very wide range of symptoms that they struggle with, from concentration difficulties, memory loss, chronic headaches, difficulty with their vision, problems with their balance. The more common ones are obviously inability to maintain the same sort of exercise tolerance that they had once before, so they get fatigued very, very easily. We've seen people that have been almost semi-professional athletes who've been reduced to unable to do much in the way of household chores without being extremely fatigued. And many of these people haven't improved over several months. Young people we've seen who've had strokes, they've had difficulty with kidney function, they've had chronic joint pain. A lot of the chronic issues that people will have from a lot of other disease states that would not be typical of most infections, we're seeing just about everything with COVID-19. So long hauling is a really serious syndrome. It's extremely sad to know that someone in the prime of their youth who is embarking on an educational career or already part of a professional career has been, as you say, disabled, at least very much impaired in terms of their ability to function properly. We're learning bits and pieces as to what we can do to try and help them from a holistic standpoint, but we have a very long way to go. And that's why we tell people that staying out of the hospital is not enough, that simply having COVID-19 can lead to a lot of these disabling consequences, and why we all need to take it very seriously and get vaccinated as soon as the opportunity presents itself to us. So thank you very much for that question.
Thank you, Dr. Sharkawy. I think Dr. Lowe wants to respond as well. I'll just move out of the way.
All right. Thanks, Khaled, for the question. Thank you, Mayor Crombie, and thanks, Dr. Sharkawy, for the detailed answer and what you're seeing on the front lines in the hospital. I think the only thing I would add is part of the reason why we are seeing these unknown but chronic effects also relates to the fact that the disease is new. This is still a novel coronavirus. And to the extent that many of us have not been inoculated, have not been infected, with the COVID-19 virus, that really speaks to, the importance of ensuring that we stick to the precautions. Because if you are infected and you haven't been vaccinated, you don't know how your body is going to react. You don't know if you're immune. So you may very well be one of the people who gets off with a mild cold, or you may be one of these people who ends up either succumbing to the disease due to a really severe presentation that requires hospitalization, or perhaps left with some of these chronic lingering effects even after you've been hospitalized and treated. So it is really vital that people understand none of us have had COVID-19 up until the point that you actually have the disease, or if your body has, your immune system has been primed with the purpose of immunization. So it is important when the vaccine comes available, ensure that if you're eligible, get your shot without delay. It stops, all the vaccines that are available in Canada are effective at preventing severe outcomes, hospitalizations, and death, and certainly making lives easier for Dr. Sharkawy and all of our colleagues in the hospital and healthcare system on the front line in helping to keep everyone safe in the community. Thanks for the question.
Thank you.
Next question.
That was actually your final question, Mayor Crombie.
Thank you very much, and thank you everyone for participating today. Today at Council, we pay tribute to the more than 500 individuals, groups, and businesses who stepped up so big to support the community during the pandemic as part of our COVID Heroes campaign. We showed a truly inspiring video produced by our cultural team and unveiled a huge monument on Celebration Square in honor of our heroes. Heroes like the group Feed Mississauga, who rallied every weekend to package and deliver warm meals to those in need throughout our city. Heroes like David Mong, owner of Floors at Work, who donated 500 masks to Peel Youth Village and close to 20,000 masks to the region of Peel for distribution to shelters, housing, and community agencies. Heroes like Anjali Chandy, a grade 11 student who started her own online fundraiser that raised over $5,000 to help provide food to her neighbors in need. Heroes like Mohammed Feki, owner of Paramount Fine Foods, who created the Mississauga Challenge that raised more than $1.2 million for the Mississauga Food Bank, and who donated thousands of meals to our frontline healthcare workers at Trillium and those in need across our city. And of course, today we recognized all of our healthcare heroes at Peel Public Health and Trillium Health Partners who have been on the front lines since the start of COVID-19, who have put their lives at risk for us. A special thank you goes out to all the nominators who took the time to fill out the applications to recognize these remarkable individuals, businesses, and groups. And of course, thank you to all of Mississauga's COVID heroes for everything that you have done to lift the spirits of so many in our community and help those in need throughout the pandemic. I am so proud to be mayor of such a compassionate and caring city. Thank you.